Well, few towns have probably grown faster than Enid, Oklahoma. In a single day, Enid went from a population of 0 to 10,000 thanks to the Oklahoma Land Run, which is chronicled in a Smithsonian-style quality at the Cherokee Strip Regional Heritage Center in downtown Enid, which is also home to one of the most misspelled streets in the nation. After the sinking of the battleship Maine in the Spanish-American War, the Enid City Council changed the name of D Street to Maine, and that's Maine with an E, like the state the ship was named for, undoubtedly confusing postmasters nationwide. Well, located in north central Oklahoma, Enid is classified as a micropolitan hub, which means it serves people well outside the city limits with everything from retail to healthcare, something that has developed into a key component of Enid's economic success. And that is where Blaine Singletary picks up our story.
St. Mary's Regional Medical Center may be based in Enid, but the scope of their services go so much further.
We serve not only Enid and Garfield County as our primary service area, but really the 9 counties that surround Garfield County.
Stan Tatum is the CEO of the hospital. He's proud to head one of 2 major hospitals in Enid that also serve rural communities like Fairview, O'Keene, and Cheyenne.
So we actually have a service area that's about 200,000 in terms of population.
For just over 100 years, St. Mary's has helped the town of Enid become an important hub city for healthcare in northwestern Oklahoma. While many of these communities have smaller, critical access hospitals, quite often they don't have the staff or facilities to get the job done.
Anytime any of those patients need a specialist, they have to refer those to a provider that can provide a higher level of care, which is typically Enid.
That means when any of those 200,000 Oklahomans need a routine medical procedure, or the unthinkable happens, the patient and their loved ones will be able to receive a substantial treatment in a timely manner without having to go too far away.
It's very important for families to have their loved ones, when they're admitted to a hospital, close, so that they can either stay with them or visit them multiple times a day. If we were not here, that would be another hour and a half for them to have to drive to Oklahoma City. And so it's very important that we have these services that are close to their home so that they can, see their loved ones on a regular basis.
And they give personal attention to each and every one of those 200,000 whenever they walk through the door, or even the parking lot, with rides being given by the Saint Mobiles. And everyone, up to the CEO, takes part in making sure their patients are getting the most of their care.
The benefit of that is that there's a lot fewer needs to hit the call button, so the nurses are trying to anticipate the patient's need as opposed to react to them.
St. Mary's also boasts an inpatient rehabilitation institute. One of a kind for this area, it gives some important treatments to people with debilitating illnesses. Lori McMillan is the director.
We have patients that come up here that have had strokes and brain injuries, a variety of other kinds of medical illnesses. So the emphasis is really on physical, occupational, and speech therapy, trying to get those people back home after they've been ill.
A facility like this one is not only good for their patients, but for those who are training and budding as medical professionals.
We actually attract students from outside areas as well as students from the Enid area to fill these positions.
And that touches on another big way regional hospitals benefit the Enid community, the economy.
You're bringing people in who maybe wouldn't have lived in Enid before, but they become consumers and have dollars to spend in the Enid community. So, that's a big contributor, I think, to our economy.
With St. Mary's and nearby Integris Hospital ranking in the top 5 employers in Enid, Stan Tatum agrees.
Because when people look to locate their business in a particular community, the 2 predominant things they look at is the education system for the kids and the healthcare providers that you have in town. And if you don't have those, it's a major deterrent for new business coming to Enid.
These kinds of hospitals bring a slice of big city healthcare in a small town sentiment. This closely knit community and team know how to keep moving forward, addressing any obstacle in their way.
We have a meeting every Monday morning to talk about challenges and issues that we face, and we strategize with our board and our medical executive committee about things that we need to do to be successful. And it's a new crisis every day, it seems like, that we have to address. And I'd like to think it's that group decision that has made us successful.